A number of pregnancies in Missouri are ending in tragedy. Missouri ranks 42nd when it comes to maternal mortality rates. And Alexis Zotos is breaking down efforts this week to keep mothers and babies safe. Alexis?
Well, Corey, right now, as so many people are celebrating International Women's Day, there are some pretty sad statistics when it comes to mothers here in Missouri. Heart disease, preeclampsia, mental health, those are some of the top killers of women in childbirth and in those months after having a baby. There is a group that plans to leave here from St. Louis to head to Jefferson City tomorrow morning to call for change. Inside Jamaa Birth Center in Ferguson, they are working to improve the maternal mortality rate in Missouri.
A lot of it has to do with access to care, but also when you think about the racial disparities, a lot of times Black and Indigenous people, they aren't getting the proper education and information about what's happening with their bodies, and so they may go home, they don't have support, and they don't understand the changes that their bodies are going through, and they have a newborn baby.
According to the latest statistics from the state, there are 39 deaths for every 100,000 births.
82% of those deaths were preventable.
Bianca Salas with March of Dimes will drive to Jefferson City to ask lawmakers to pass legislation that could make a difference. This includes Senate Bill 698, which calls to expand Medicaid from 60 days to a full year after a woman gives birth.
13 years ago, I was pregnant with her and I was on Medicaid. My eligibility ended at exactly 60 days and I barely was able to see my provider one time.
Salas suffered from postpartum depression, which began a few months after her daughter was born. But the bill, which has bipartisan support, might now be in limbo after a lawmaker tacked on a new amendment.
My Senate amendment, which is the defund Planned Parenthood amendment, is pending right now.
St. Charles County Senator Bob Onder says the amendment calls for no taxpayer money going toward abortion facilities. Onder calls this a procedural tactic.
The great majority of policy gets passed not as a standalone bill, but as an amendment to other bills.
But those working to keep mothers safe say politics could cost lives.
We are literally killing mothers by saying we're cutting you off at 60 days, and these are people who are low income and at the highest risk.
So the group with March of Dimes will head to their March for Change tomorrow in Jefferson City, asking lawmakers to help pass these and other bills that help Missouri mothers. Count on News 4 to let you know what happens with the bills. In downtown, Alexis Zotos, News 4.
Alexis, thank you.